There we go. The trick is going to be able to get this to actually perform the way we want it to, but like all good presentations, you should start off with some objectives. So I thought in the time we've got tonight, we'll identify some of the more popular reasons to study clinical hypnosis, identify some of the published articles supporting the use of hypnosis in clinical settings, and recognize and respond to some of the common myths about hypnosis. One of the things I'll do, which will be an experiment here, is one of my friends, Michael Yapko, has been published extensively in the field of hypnosis. He attended Michigan with my twin brother, and he and his wife got married the same summer we did. We both just hit our 40th anniversaries, so we have a lot in common. But I asked him, while pointing a video camera at him, what he thought as far as why should somebody study hypnosis. So we'll see how well you're able to see this. There we go.
Well, it's a big question. There are so many advantages, so many important things about studying hypnosis. Let me mention just a few of them. I think the first and most compelling reason to study hypnosis is because of all the extraordinary insights it gives you into subjective experience, how people form their experience for better or for worse. The same patterns that you're going to be studying clinically to help people are the identical patterns that people use independently to generate states of distress. You can use imagery to, for example, imagine good things happening that make you feel better, and you can use imagery to imagine terrible things happening that scare the hell out of you and make you feel bad. So having that in-depth understanding of how people generate experience, I think, is a huge contribution of the hypnosis literature to our understandings of people. Secondly, a very compelling reason to study hypnosis, especially these days in terms of empirical research, is that hypnosis works. That if we ask the question, if we compare, let's say, hypnosis to CBT for the treatment of depression. Depression happens to be an area that I've spent my professional life researching and studying and treating. The question is really a bad question. It's not CBT versus hypnosis or psychodynamic approaches versus hypnosis. The salient question is, if we do CBT without hypnosis and we do CBT with hypnosis, will the addition of hypnosis enhance the treatment effects? And the answer is clearly yes. And so a very compelling reason to study hypnosis is because it does, in fact, measurably enhance treatment outcomes, and isn't that what we're all striving for? The third reason I think studying hypnosis is so important, especially in today's world where people are feeling so victimized and disempowered and frustrated and blocked and just struggling. The idea of teaching people a deliberate means of finding resources inside themselves that they can use to not only cope but to transcend, I think, is a vitally important part of what hypnosis allows people. That contrary to the popular misconceptions that suggest hypnosis is somehow going to disempower people or take control away from them, it's the exact opposite. And having been in this field now for more than 30 years and studied many, many different forms of psychotherapy, I have yet to encounter anything that has the potential to empower people the way that hypnosis does. So I think I've given you three very compelling reasons to want to study hypnosis, and if I had several more days, I could give you several thousand more.
Now I see an email from Christina here that she's having trouble getting dropped, and I've heard a number of pops in and out. I have just to check in. It looks like we still have a lot of people on board. Rich, are you still there?
Oh, yes.
Okay.
Christina is showing as being logged in about 6 times.
Right. She sent an
Chris-
email asking if anybody else was having trouble getting dropped. So apparently she's having a hard time holding on to the thing. Did the audio and or video come through all right for you?
Christina's on mute.
I'm fine.
Christina, your computer is trying to connect about 6 different times. So unless you have incredible speed, you're going to, your own computer is going to keep dropping you.
He's there and gone again. So I guess we'll go on. If Christina can hear us, you might do a better job calling in by phone and then just trying to see the screen on her computer without keeping the audio on the computer. But we'll let her figure that out as we go along.
Christina, if you can hear me, nuts.
There she's gone again.
All right, never mind. Just go ahead.
All righty.
If you get a message from her, have her call me.
Okay. So, I've always said when somebody can have a camera pointed at them and just off the top of their head rattle off multiple reasons like this, but, his first point was on the whole area of subjective experience, which reminded me of another interesting interview I did with Pierre Rainville, who's a neuroscientist who I thought was an old French guy because his literature has been around forever, and with a name like Pierre Rainville. Turned out he came to one of our conferences, and he's a relatively young Canadian, and that his seminal work was published while he was still in grad school. So he's not quite as old as I thought he was, but at the end of the general interview I did with him, when he found out I taught at Saybrook, he asked me to turn the camera back on because he wanted to talk a little bit about hypnosis, subjective experience, and humanistic psychology. So I thought I'd add him to our little talk here on why we should study hypnosis.
Hypnosis is very unique also with respect to the classical schools in psychology. The dominant school now is certainly the cognitive school, the cognitive behavioral school. And this has also influenced a lot the neuroscience of mental function, understanding mental function in relation to brain activity. I think that hypnosis, again, is unique because it relies on the recognition of subjective experience as a key factor in the equation. And this is very, very strong in humanistic philosophy and humanistic approach. And humanistic, of course, psychology has been advocating very strongly for the recognition of subjective experience in patients and in the interaction with the clinicians. So I think that this is an approach that, or hypnosis can help revive the humanistic approach and combine it with neuroscience to improve our understanding of mental function in relation to brain activity.
So something I didn't really expect to hear a neuroscientist basically promoting hypnosis and humanistic psychology, but it's becoming an interesting world when you talk about integrative medicine. The second point that Dr. Yepko made was, the area of empowerment. That, I generally teach that hypnosis is a gift, but it's a gift for the clients because it's their ability. It's not something that you do to someone. So similarly, if I was a music teacher, I wouldn't do music to you. As someone using hypnosis, I don't do hypnosis to you, but I take your hypnotic ability and help you learn to use that. So if you think of it in that terms as a gift, then the empowerment becomes really important as something that your clients can leave with some abilities that they may not have had when they came into your office. So I thought I'd go to Canada to, because I love her accent, to talk about a little bit of pediatric hypnosis and the use of self-regulation.
My area of passion is pain management, and working both in the hospital with acute procedural pain, recurring pain, as well as chronic complex pain, it became very evident that we are shortchanging children by not using some of the natural talents that they have, and that is using their imaginations. Hypnosis is brilliant, absolutely brilliant in helping children navigate through the long line of needles, through the uncertainty of diagnostic workup and treatment-related procedures that can be really very painful. Until only recently, medicine has been quite neglectful in terms of applying analgesics to children. So in the last 15 years, there's been terrific progress at using more effective local anesthetics, using conscious sedation, using even short-acting general anesthetics for these painful procedures. But hypnosis has been my absolute, reliable, loved strategy, gift, technique that I've used for many, many years. Now, one of your questions.
And she would keep talking a while if we let her. His third point was that it's an empirically validated treatment, and there's a stronger and stronger literature on hypnosis in a number of areas, looking at it being empirically validated, specific in terms of different diagnoses. One of the articles by Mendoza and Capafans was the efficacy of treatment hypnosis summary. It's empirical evidence. And I just thought I'd, for the recording, read this. Hypnosis is a valuable clinical intervention for the treatment of a wide variety of psychological and medical problems, which helps improve the quality of life in patients. This paper reviews the state of evidence regarding the efficacy of hypnosis, taking into account the most rigorous research results in this respect, together with other studies of clinical relevance, although they do not fulfill stringent methodological criteria. Overall, the findings of research indicate that hypnosis used as an adjunctive to other medical or psychological interventions increases the efficacy and/or efficiency of these interventions. Moreover, hypnosis efficacy is well established in certain clinical applications, especially pain management and other medical conditions, and there is acceptable evidence for its efficacy in treating depression, sleep disorders, smoking cessation, obesity, asthma, and enuresis in children. According to the literature to date, continued research using randomized controlled methodologies as well as adequate sample sizes is well justified and essential in order to establish the efficacy of hypnosis in other areas. So it is a few steps away from the voodoo that it sometimes has. That the image is that there are still some people where it's kind of in the too woo-woo for you category, and yet there's, say in pain management, there's probably nothing that's been studied as long and as thoroughly as hypnosis. It's been used specifically for pain for over 300 years. The 1800s saw surgical procedures using hypnosis as the only anesthesia. If you go to the American Society for Clinical Hypnosis webpage now, there's a beautiful, nice new video up of one of our members having an abdominal surgery using hypnosis as the only anesthesia. So, you know, the human mind is still capable of blocking pain through hypnosis. And it was actually, 1842 when they discovered chemical anesthesia. Up until that time, the way they discovered it was that street professors were up on stage making people do stupid stuff when they breathed in laughing gas or nitrous oxide. With the discovery of nitrous oxide as an analgesia, 100 years later, we have people up on stage doing stupid stuff with hypnosis, and the chemical anesthesia is in the hospital. So there was a 100-year flip-flop there, but the capacity for the mind to alter the perception of pain has never diminished. It's just the techniques that we use. And I mentioned the journal articles. These are the two primary ones of the two major American groups. There's the American Journal of Clinical Hypnosis, which is the ASH journal, and the International Journal of Clinical and Experimental Hypnosis, which is the SESH journal. Both of those, by the way, are in the Saybrook database, so at any time you want any articles about hypnosis, I see I have an old photograph of this international journal here, because it's now Taylor and Francis as well. So both of these are the Taylor and Francis databases. I see a note here from Jerry wondering who the last presenter were. I'm assuming you mean the woman talking about hypnosis being simply brilliant. And that was Lenora Cutler from British Columbia. I can send you some contact information on her if you'd like it. This young man who's about to yell at us is James Bray, is the past president of the American Psychological Association, also a member of Division 30, which is the division for psychological hypnosis. And again, you can see I kind of caught him in the hallway at the meeting and simply asked him, why should graduate students study hypnosis? And we'll hear his answer, maybe. There we go.
I think hypnosis training provides a couple of very important things. Number one is it's a very effective evidence-based practice that you can add to your skills as a psychologist and clinician. And it provides you a different kind of understanding about humans and an effective way to help them change themselves in an effective way. The second thing that I found about hypnosis training is that it teaches you to really pay attention in a different way to people's physical cues. It teaches you particularly to be very careful about the language that you use. And I find that training to be invaluable in all the other psychotherapy that I do with people. So I frequently rely on the training that I had in hypnosis, and I use it in whether I'm doing CBT or family work, or even sometimes when I'm in meetings, running meetings, I think about what I'm observing and how I'm observing and what people are telling me with their body language. So I really encourage you to take the time to learn this. It's a very effective way and has a lot of applications.
Which makes you wonder how he became president of the APA, and it's possible that he did use it in some of those meetings. So he talked about the increase in awareness of body language, the power of words. There are certainly a number of horror stories of patients who were harmed because of the way physicians use their words. They often don't realize that when we're in the ER or in a doctor's office that we're already in somewhat of a state of trance and very influenced by the language that's used. One of my favorite stories is, of course, a woman who in England who had surgery, and when she was discharged, it happened to be an Australian intern that came to discharge her and said, "Good morning, Mrs. Smith, we're sending you home to die." And she proceeded to go home and do quite badly until they had to readmit her. And one of the charge nurses there was experienced in hypnosis and kind of went back with her what had gone wrong since she had left the hospital, and discovered that her belief was that the surgery had failed and that they were literally sending her home to die. The moral of that story is try never to be discharged by an Australian. I'm not going to play this video because the sound on it turned out very poorly, but his contribution to another reason why you should study hypnosis is that it's fun. In his mind, he's been doing this for 30 or 40 years. He's president of the Australian Hypnosis Society. where they teach you how to discharge patients. And he said, what's the use of being involved in a career if you can't have fun doing it? And so for him, the ability to teach people the self-regulation, teaching them hypnosis is one of the more fun parts of his job. So we add that to the list of reasons to study hypnosis. One of the issues that always comes up is the field's inability to define what hypnosis is. In about 2010, the APA had a large group together to form a definition of hypnosis. But unfortunately, when you're made up of psychoanalysts, people who follow cognitive behaviorals, social cognitives, traditionalists, what we ended up with was a very long and extensive definition that satisfied nobody. And that's pretty much how they got success, was the fact that nobody liked it was, didn't favor anybody. In 2014, we came up with a revision, partially because of the need that, you can't recite someone 2 pages worth of material trying to give a definition. So the current definition from Division 30 was that it is a state, although you'll notice it doesn't say an altered state, because cognitive social people don't see no reason for a altered state of consciousness explanation. But we did agree to call it a state of consciousness involving focused attention, reduced peripheral awareness, characterized by enhanced capacity to respond to suggestion. So it's that narrowed, focused state of attention. This is Dr. Rich Clough. He's a psychiatrist down in Philadelphia. For 25 years, I've been asking people, what's their own understanding or definition of hypnosis. This is still one of my favorite answers from our president of SESH at the time.
Hypnosis is something I think I understand for about half an hour, maybe twice a year.
So I thought that was a pretty good summary of the field's general ability to really define itself. So one of the things I tried to do in a presentation one time was, you heard me do a comparison. If I'm a music teacher, I don't do music to you. Hypnotic ability kind of follows the same normal curve as musical ability or artistic ability. So I thought I'd cheat and just jump over to look at the definition of music and see how well it would apply to the definition of hypnosis. Unfortunately, what I wasn't aware of, even as a music major, was that the field of music has the exact same problem as the field of hypnosis. They haven't been able to define music, whether it's a trait, a state, or a social construct. So Wikipedia, how to define music, has long been a subject of debate. Philosophers, musicians, and more recently various social and natural scientists have argued what constitutes music. The definition has varied throughout history in different regions and within societies. If you put the word hypnosis in there, it would be perfect. Some of the issues. Postmodern and other theories argue that, like all art, music is defined primarily by social context. According to this view, music is what people call music, whether it's a period of silence, found sounds, or performance. The traditional definition was organized sound. Musical aptitude or musical talent was the potential or capacity for musical achievement. Again, if you switch out the word hypnosis, we're dealing with very much the same problems and the difficulty of it. So in the music, we have the Willmarth twin study, which began in 1954, because I grew up with a twin brother, and both of us were known as good musicians. My brother was a great sight reader. If you had the music in front of him, he could play it. But if you took the music away, he couldn't play a note. On the other hand, I would sit there with my bassoon and play whatever melody came into my mind, because I thought that's what you did if you played an instrument. My brother had assumed that I had the music, had memorized the music, and I was playing from memory, because for him to play without music, that's how he would have had to do it. The end result was we were both known as being good musicians, but we had a completely different skill set to come to that same conclusion. And I think that's pretty much what we end up with when it comes to hypnosis. That I think there are people who have different levels of hypnotic ability. Some it's very intuitive. They feel it, they experience it. I think for others it's a very cognitive exercise, that they have a much more of a left hemisphere component into getting into that trance state or to following those suggestions. And that different elements, while some of it's hardwired, probably less of the social cognitive factors if you are naturally hypnotic, probably much more of expectancy and social factors if you have less natural hypnotic ability. So I think it's very similar to the stories. I won't go all through all of these that I did from a presentation, but there is a nice story about dissociation being one of our primary factors in hypnosis, you know, that dissociative experience that you're both here and not here. There's a story of a man who eventually became a professional musician, but his very first performance was in church, and he had practiced extensively for it. He got up on Sunday morning, the piano started to play, he closed his eyes, put the trumpet to his lips, and as far as his own perspective was, he didn't miss a single note. He played it perfectly, which is why he was a little surprised that afterwards people smiled at him, but they really didn't say anything. And you know, he says, you know, you're not supposed to be playing for your own recognition, but it turned out it was about 3 days later before a friend told him that not a single note had come out of the trumpet. That while he was basically hallucinating his performance, playing every note, he was so nervous that his lips were tight that no air actually went through the horn. So his own ability to dissociate allowed him to have a perfect performance even though no one in the audience was able to appreciate it. This was just I'm not going to show this video either. It just goes through, you know, 100 people who were in the study. You actually get to see them, but I have interviews from people from 25 different countries. 26% of them were female. And all individuals responded to the question, can you share with me your own definition or understanding of hypnosis? All the answers were kind of off the top of their heads, no studying involved. This one ranged from 1996 to 2011. And although the social cognitives around this time were declaring victory, that claiming that there was no such thing as an altered state and that it was a social construct, the clinicians and researchers who were actually dealing with hypnosis didn't seem to agree, because 71% began their definition by stating that it was an altered state. Only 16% described it as a social interaction or a relationship. 16% mentioned the feature of dissociation. 26% referred to it as focused attention. 13 talked about the increase in suggestibility. 10% talked about the factor of absorption. 12% referred to it as an ability or a skill. 11%, and this probably changed over time. The more recent, I said if we did this today, neurological change would have a extremely higher percentage now that we've done fMRIs, and it's really rejuvenated the whole area of hypnosis because of the neurological changes that go on. Not only 9% referred to it specifically as being unconscious. Only 7% used the word trance. Expectancy was in there, 5%, and the pure social cognitives, talking about demand characteristics, was only 2%. So 5.5% were talking about imagination or the involuntariness of it. 3% of these people who were experienced hypnotists coming to hypnosis conferences claimed they had no definition for it, and 3% said that their definition had changed over time. So based on all of that, we come up with the correct definition, which is that clinical hypnosis is the intentional application of an individual's hypnotic ability for therapeutic change, and that an individual's hypnotic abilities may be primarily cognitive or intuitive, learned or enhanced and altered by environmental context. And for more stories about hypnosis, you can visit the hypnosiscentral.com website, which is where you'll see some of the several hundred interviews that I've done with people throughout the years, where I ask them not only what their own definition of hypnosis is, but also talk to them about what their favorite story about hypnosis is, and their predictions for the future, and how they've seen it change, and who their mentors were, and other elements like that. So I think that's my official long-winded spiel on why you should study hypnosis. So I think if it's all right with you, Rich, we can let people turn their microphones back on and see if there's any conversation we have about this or any questions.
Go ahead. Everybody go ahead and unmute yourselves if you want to talk.
Unless, of course, I've already helped you off into an altered state of consciousness.
This is hysterical.
Well, let's see. We've got Shelley and Jerry with their microphones on. The others, I think I put
There goes Sam. All right, there's a few people awake.
Well, Eric, I want to thank you for your presentation. I also want to find out how to get in touch with Leora Cuddle. Yeah, well, when I think of the reasons for hypnosis, you've hit on the things that motivated me to be a student of hypnosis. I'm very keen on things that work, and especially if they're fun to do. And I found that things that are self-empowering, both for the patient and for the clinician. And I found when I was thinking about what could enhance my cognitive behavioral orientation, basically I decided to be greedy and go for, I thought biofeedback is definitely a practice enhancer, and hypnosis is a practice enhancer, and if I choose, I went for both.
Well, and I think I emailed you earlier that next year there'll be a special edition of the American Journal of Clinical Hypnosis talking about the integration of hypnosis and biofeedback. So I think there are a number of us. Early on, it was Helen Crawford, who was a researcher in hypnosis, but also very much involved with the EEG biofeedback research. Corey Hammond has been president of both the INSNR and the Hypnosis Society. So there have been a number of people throughout the years who, and I've always looked at those as really the twin pillars of self-regulation, that between hypnosis and biofeedback, even as far as personality goes, that you get those people who are intimidated by wires and computers, but are very comfortable with wandering off into trance, and conversely, people who really have little hypnotic ability, but are much more drawn to the science and rigor of biofeedback because it seems more medical to them. So in pain management, you have kind of a bimodal curve, overrepresented with people highs and lows without that many in the middle. So hypnosis and biofeedback do really make the perfect twin combination. And probably one of the reasons to study that I didn't put in the slideshow would be in terms of your practice. 10 minutes before I came on, I had a referral from somebody on the other side of the state who was referred by David Spiegel from Stanford, who wanted to try hypnosis for pain management. I have a number of doctors that refer to me specifically because I do hypnosis, a number of other doctors specifically because I do biofeedback. I think all of them probably think that that's all I do all day long is sit where either with my computer or my magic wand. In reality, probably 30% of the time I use one or the others of those, and most of the time I'm just sitting and doing counseling. But I think it becomes, if you're known in that area, I think it becomes a niche that people think of you if they're thinking of one of those as possibly something that could help their clients. So maybe a ninth or a 10th reason that we could put on the thing was that it helps build a practice. It gives you a specific identity, a specific reason why people may want to refer to you. So.
And we could probably particularize that because if you do biofeedback, most insurance companies won't pay for that. But if you do hypnosis, most insurance companies will pay for it.
Yeah. So for those of you that aren't in it just for fun and actually want to make a living at it, it's a nice skill to add.
Hi, can you hear me? Hello?
Hello?
Yeah, hi, this is Brian. I have a question for you. What are your thoughts on the application of hypnosis in the area of doing work with clients who have serious trauma issues?
Because it's one of the areas where it is used extensively early on, and it was with probably horrible results. It got us into the whole false memory debacle, which unfortunately really had to do with memory, not necessarily hypnosis. But I think if you think of hypnosis as a form of self-regulation, trauma patients are in desperate need of increased control. I mentioned David Spiegel a minute ago. Dave Spiegel has a number of protocols specifically working for PTSD, and uses a split screen model where, say, you may progressively relive some trauma, but you've got a controller and you have the other side of the screen where you can completely change controls, turn off the TV, switch channels, always giving the person control, basically the hypnotic memory / hallucinations. It's an area that one of our things in hypnosis is that you're not qualified to do something with hypnosis that you're not qualified to do without hypnosis. So learning hypnosis won't make you an expert in trauma, but if you're an expert in trauma, hypnosis is probably a tool that can make you better at what you do. And that's really true for any field in here. That it's one of the scary things about the lay hypnosis groups is that they train you in hypnosis and give you a certificate, but their scope of practice is essentially zero unless you had some other scope of practice. But they don't tend to push that a little bit, so it's kind of scary to see some of the ads. One for the American Guild had a guy on the testimonial that said essentially, when I dropped out of high school, they said I'd never amount to anything, but I'm making lots of money as a hypnotist once I got certified by. So, it's kind of scary to wonder who he's treating and for what, now that he's dropped out of high school and has learned how to do hypnosis. So, so it's always the caution is that, you heard them talking about that it makes cognitive behavioral therapy more effective, but you have to be qualified to do cognitive behavioral therapy before you add hypnosis to it. So, trauma is a very common area where people do add that skill, but even in schizophrenia, which we used to be told you'll never use hypnosis with schizophrenia, Elgin Baker is one of our past presidents who works exclusively with schizophrenia and has been very effective using hypnosis in some of his settings there. Amanda Banier in Australia is doing a lot of research with schizophrenic hallucinations and trying to reproduce them in the lab with hypnotic hallucinations and suggestions. So it's just, you don't want to jump into some brand new area with hypnosis that you don't have the training for to do without hypnosis. That was kind of a long-winded answer, but did I hit your point?
Yeah, no, that's great. Thank you.
Let's see. It looks like almost everybody has their microphones on.
If you're going to study hypnosis, if you choose to study hypnosis, how much training do you think somebody needs in order to start using it?
Well, most of the training programs have a graduated model. The kind of the gold standard is the American Society of Clinical Hypnosis has a certification program that starts off with a 20-hour basic workshop. When you complete that, you're kind of expected to be able to go and practice and actually try it out with people, get your volunteers, and then follow up with supervision. It's followed by an intermediate where you do a lot more specific work in terms of different disorders and things like that, and again with supervised experience at the workshops. And then there's another 20 hours of individual consultation with an approved consultant, which is basically somebody who's had at least 5 years of training and lots of workshops to be a supervisor. So the Saybrook courses are approved by ASH because we follow the same standards of training, the same categories that they've published as the standards of training and the same format. The difference being that we don't spend as much time in person as you do at an ASH conference, but we spend a lot more time online and a lot more academic in terms of the books and articles and things that we have our students do that ASH doesn't. So, but it's really it's geared at about 100 hours of training to be fully certified. But after that first 20 hours and the materials, you should be at a good point where you can at least start introducing it to people and learning away. I went to lots of trainings before I ever had the nerve to actually try it on real people. I read the book about Milton Erickson, who was a freshman at the University of Wisconsin, took one class with Clark Hull, came home that summer, hypnotized all his friends and families, and was teaching the class before he was a senior. He was teaching the graduate class. So I figured if some freshman could go home and practice all that, I could probably eventually get out there and do it myself with my graduate degree and the courses I had taken. So, but I think the main thing is to have enough supervision so that you can call somebody up right after they start clucking like a chicken and ask what went wrong.
Eric, this is Rich. Would you comment on hypnosis being used by teachers and coaches who are not clinically trained? You've made it very clear that people working with clinical problems need to be clinically trained, but how about people who are not clinicians who are properly trained to work with their own clients?
Right. It's really a huge issue in the U.S. right now for a number of reasons. One is the official societies require at least a master's degree in order to get the training. You're either a student or have a master's degree. On the other hand, in Europe, they have a very different educational system. So, like the president of the Australian Hypnosis Society does not have an advanced degree by our standards. He's a psychotherapist, but they have a whole different training thing. The other issue is, of course, what was in the news a while ago, the principal that was hypnotizing students, 3 of whom died, none of whom probably had anything to do with the hypnosis, but that certainly made headlines, and he was out of bounds in some of what he was doing. I don't believe for a minute that any of those had to do with whether he got in a car accident 3 weeks afterwards or things like that. But then there's a whole field of peak performance. So there are a lot of people that use it. A high percentage of Olympic athletes are trained with hypnosis at some point during their training. Students in tennis are trained extensively with both biofeedback and hypnosis. So I think there is an appropriate area if someone's within their scope of practice. But even then, most of them have a supervisor so that if there's any abreactions, any other things, they have instant access to back up and support. But it's a hot topic. I mean, you think about even nurses. I work in a pain clinic where our nurses are fabulous, but a lot of them are bachelor's level. I would love them to have hypnosis training, but at this point, they're not eligible. The board of ASH did vote to allow them to have training, and the membership squashed that by about 70%. So at this point, to be a part of the actual hypnosis community, those people are kind of shut out of it, which is why probably the guild and some other places are so large, is that there are lots of people that want to use it in those kind of settings, and that's the only place they can get their training. So by the professional groups shutting their doors to it, they're kind of driving them into other places. And so I don't know how good of training they're getting, but there certainly is a large field of people using that, and some of them probably very appropriately for coaching, peak performance, and things like that. Mm-hmm. But I don't think that's one that if you ask any one of the societies at large that you'd get an agreed answer. I think there's still a lot of people on both sides of that fence.
I think the key that you gave is that people who are not clinicians who are using hypnosis need to have an appropriately trained clinician on hand to handle problems that come up that aren't expected. And I believe that's the key answer. That's a requirement.
Well, think of your high school.
Make that stick as part of our training.
Right. Think of your high school football team. They've got, generally they won't have a physician on the sideline, but they'll have an athletic trainer. But that athletic trainer certainly has a hot number to an MD, so that if something goes wrong, they've got instant backup. So, yeah, I think you're right. You've got to be in a situation where the clients are safe. So while the athletic trainer can do a lot of things, he's not going to, protect them completely without that backup.
Well, we're about out of time. Everybody, this is your last second.
And you may all be surprised at how well you actually sleep tonight after this short.
Oh, that's funny.
All right. Well, thank you, Eric.
Thank you, Eric.
You're very welcome.
Yes, thank you, Eric.
Thank you, Eric.
Have a good night, everybody.
Okay. Good night, folks. I'm going to close the presentation.
All righty. Thanks, Rich.
Okay. Thank you, Eric.